There has always been consensus that Uganda's health sector is underfunded and cannot deliver the minimum health care package to Ugandans. It is against this background that the National Health Insurance Scheme is looked at as a catalyst to achieving universal health coverage by financing for health through pooling of resources. It is worth remembering that the National Health Insurance Scheme Bill was passed by Parliament in March 2021, but was not ascended to by the President. Members of the Parliament, particularly those on the Health Committee, are furious that this well-intentioned scheme meant to improve access to health care has delayed to see the light of the day.
So for me, I think we need to compose ourselves into a strong advocacy team that is going to bring his constituents on board, the constituents of Musei, the other elderly who are suffering, the elders, because those are the people that suffer with the medication that we are talking about. We bring his constituents on board. Those elderly women you see in Parliament, they speak for this thing.
Now come on board and decide if government is not ready to bring it back first, then we can think of how to bring it as a private labor's bill.
The chairperson of the Health Committee, Dr. Charles Ayume, pledges the support of his committee towards the attainment of the National Health Insurance Scheme for the country.
You keep on putting money into a pool and in anticipation of a risk, which risk we do not know, that we don't know exactly when that risk will come. And the risk in this case is poor health, whether it's an accident, whether it is malaria and so many other things. So you're putting little money, but you're going to benefit from economies of scale by many people putting money into areas. And as a country, we are looking at how do we also look for alternative avenues of domestic financing, and national health insurance is one of those that we have looked at.
The Deputy Chairperson of the Parliamentary Health Committee, Joel Sebikali, is dismayed that majority of Ugandans have remained in poverty because a high proportion of their income is spent on medical expenses.
If our members in the community, they lose 41% of their total income annually to cater for these programs, then you cannot expect these people to grow economically. Not forgetting that our SDGs, number one of them, nowadays I'm studying and I was told to make a notice on SDGs. Number one is no poverty. Number three is health and well-being. When you provide medicines, trained personnel, infrastructure, everything, then the money that would be spent on these other diseases, on treatment, can develop these people.
The front desk officer for National Health Insurance at the Ministry of Health, Ali Walimbwa, concedes that the National Health Insurance Scheme will act as a social protection mechanism for Ugandans.
It is also supposed to be a social protection mechanism that when people fall sick, they shouldn't die at home, or they shouldn't sell their property, but they should be resilient in terms of making sure that they are protected. Therefore, it will be helping people to avoid risks of selling their property, seeking healthcare late, but also has a benefit of making sure that those who have subsidize those who don't have.
Renowned health experts like Professor Francis Wamaswa point out that the country's leadership needs to be convinced that the National Health Insurance Scheme is possible and can be successfully implemented.
We don't have a National Health Insurance Scheme, but let's have it, let's make it happen. So why is it not happening? What's the gap? In my assessment, the biggest gap is that we have not convinced His Excellency the President that this is a good thing to do. That is the gap. Maybe he is convinced that it's a good thing to do, but we have not convinced him that we can do it without embarrassing the government.
Partners in Population and Development, an intergovernmental alliance of 25 developing countries, including Uganda, is supporting the realization of the National Health Insurance Scheme through health-focused partners.
The biggest role of government here is to regulate, to pass policy, to have this well, regulated and put in place. The first important thing that if I am calling out to government is to say, have this bill passed in Parliament and create a law, formulate whatever procedure they will take. I know that now the regulation has been and it had been passed. They will form an agency and people will align to that, something akin to National Social Security Fund or some. People and individuals will contribute money to that fund. But this must be regulated by government. The biggest role by government now to this issue of national health insurance is to regulate, to pass a law. This we have been at for the last more than 30 years. I don't know why government is not passing this law.
The National Health Insurance Scheme is a pathway to achieving health system reforms that can support the pursuit of universal health coverage. Sada Mubale, Adia Nakuti, UBC News.